We are back on the couch. Welcome back to Outnumbered. Not one mention of the ObamaCare website in last night's State of the Union, although it was an obsession in States of the Union past. But the site is making very big news today, according to a government watchdog agency, as the administration hired dozens of contractors to build Healthcare.gov. It skipped crucial steps that may have prevented the disastrous rollout. The Hill reporting, quote, out of 6 contracts examined by the Inspector General's office, only 2 had been properly vetted before the government gave the green light. Most of the contractors also lacked cost estimates and signatures from agency officials to sign off on the project. The Inspector General also raised concerns with management as the project as a whole, underscoring that there was no single point of contact to oversee more than 60 contractors. Meantime, some major privacy concerns for anyone who uses Healthcare.gov. The Associated Press is reporting customers' personal data is quietly being sent to private companies that specialize in advertising and analyzing internet data. That information can include your age, how much money you make, your zip code, whether you're a smoker, and if you're pregnant. And now leading lawmakers have sent a letter to the Obama administration asking for an explanation as to how they make sure that information isn't improperly shared. So, Andrea, I ask you, is this incompetence or was this a rush to get the site up and running?
I think it's both. And there's a huge focus on this, not just because we've seen Central Command be hacked and we know that cybersecurity is a threat, but if you look at the information, and you mentioned some of it, Kennedy, that people have to submit if they want to sign up, it's more than just the typical age, birthday, social security number. I mean, you have to provide details about criminal past, immigration, and what makes this different is the government agency, the IRS, is sending that information to each government agency to cross-reference it and to validate it. And so it's being sent all over the place, only to be sent back. So our information isn't just in certain agencies, it's in all the agencies and
centralized and disseminated.
And it's also in the hands of the insurers, which is another worry that they're going to...
You make a good point. I mean, this is your most personal information. What you submit on an insurance, a health insurance application, I can't imagine anything that I would want compromised less. Now, Stephen, I know you share my love for protecting civil liberties. How does it put the average American's privacy at risk?
Well, I think I'd be very nervous putting my information in there. In fact, I had a conversation with a doctor, this is now a couple months ago, and we were talking about the kinds of questions that were asked on the website, and the doctor said to me flatly, I would lie. I wouldn't share all my information because I was worried about, I'd be worried about it getting hacked. I mean, it looks like this, we knew what the problems were, and now we have an explanation for the problems, and the explanation is this has been implemented precisely the way that it was passed, which is to say thrown together last minute, you know, one side not talking to the other, one bureaucracy not sharing information with the other, and then sharing it quickly and in an ad hoc way, in a way that I think is troubling.
And so critical that this should have been carefully measured, and it wasn't.
It wasn't. First of all, also the CFPB that was started by Elizabeth Warren, the Consumer Protection Board, is also collecting all of our credit card information, so you can add that to it. I just want to say, just as a regular person, if you've ever met somebody that's had their identity stolen, it is traumatic, and if you're busy, it takes up hours of your life. For a president who claims to care so much about people, why he would risk, you know, hackers, you know, basically upending your life and uprooting it with this drama over a political agenda or over a political timetable.
Well, because it's about control.
Says a lot about, exactly, it says more about control than it does about caring.
Yeah, you know, I've got a copy of this letter here. So,
I know you're going to bottom line it for us, Harris.
Well, I don't know if I can bottom line it because I think we're still waiting to get to the bottom line. I mean, this has been a criticism since very early on with Healthcare.gov. I mean, even before it rolled out, there were questions, if you'll recall, about what was being done in terms of cybersecurity. So the fact that you've got this now letter from Orrin Hatch and Charles Grassley, you'll notice Administrator Tavener, well, she just quit. She's leaving soon.
So she's the latest woman to be sacrificed to the Obama altar.
You love to call it the war on women. Yeah, because then there was Julia Pearson with the Secret Service, and nobody else has been fired. And blah, blah, blah. Yeah, no, I hear you. But with Tavener, what's interesting is they're also getting this on the record under her watch. And perhaps that's necessary just to show us how badly this was handled from the beginning. But my question is there going to be enough time between the time that she gets this letter and the time she's leaving for her to address this? I mean, maybe there should have been a few other people on this
No, she's been a lowest learner. She's going to peace out, and it just shows from the NSA to the ACA, the government knows everything, and they don't care at all.